Thank you all for joining us today for a very special GlobalSkin and ILDS webinar, Changing the Way the World Sees Dermatology through the GRIDD project.
Good morning, good afternoon, and good evening all over the world. So I myself, Dr. Ramesh Bhatt, presently working in India. I'm the professor of dermatology. I'm working in the field of dermatology for the last 30 years. So it is my proud privilege to introduce ILDS to our august audience. So ILDS represents 196 societies from more than 90 countries, representing over 2 lakh dermatologists. You can consider ILDS as the global leader of dermatology. Our vision is to attain the best possible skin health for all people around the world. Our mission is to increase awareness, cooperation, and communication within the global dermatology community to promote high quality education, clinical care, research, and innovation that will improve the skin health globally. In short, our main focus are: one is the subject itself, the global dermatology. Second is our patients. In fact, whatever best we can do for patients through various organizations, that is our aim. And also we are into research so that newer things can be implemented in this world for a better global skin health. So our 2020-23 goal is to strengthen and improve access to skin health around the world through partnerships. So this is through 3 important agenda. One is that strategic leadership and policy impact. So we have the various organizations working at national level, regional level, and global level. So the policy aspects of individual nations, regions, and through WHO at the global level is influenced by ILDS. That is one of our important agenda. Next is the representation and engagement. That is engagement of various organizations. Once again, this is also at global level, regional level, and national level. And also to see to that the patient-centric programs are conducted by various national societies. Then the third important aspect is fostering access to dermatological education and care. So the ILDS actually advises the various national societies in relation to the most of the advances that are taking place in the field of dermatology. So we also communicate in between the various societies, and there are mentor-mentee system also, so that the young residents and the future dermatologists will have better access for medical education. And ILDS, I am very proud to inform you that we are having a dermatology training school in Moshi, Tanzania, which is quite popular, and it helps in developing nations. Then coming to the ILDS Patients Organization Working Group, one of the ILDS objectives for the last 3 to 4 years is to develop a framework for meaningful and systematic engagement and collaboration between ILDS and patients organization and patient leaders. In fact, we have a MOU with the International Association of Dermatology Patient Organization. So our ILDS group is headed by Professor Luca Borodari from Europe, and I am vice chairing this group. And then ILDS Patients Organization Working Group, the goal is to ensure that the patient's voice is considered in ILDS activities and to foster dialogue and partnerships with patients organization to improve access to dermatological patient-centered healthcare worldwide. So at ILDS, for more information about ILDS and POWG, you can contact Somana, and more information is available on our website. So our main agenda once again here includes the fostering exchange between the patient groups and the various national, regional, and global societies. Then building strategic alliances with the various patient groups, and then nurturing and supporting patient engagements. So as I've already informed, we have a MOU with the International IADPO, International Association of Dermatology Patient Organizations. Thank you.
Thank you, Dr. Ramesh. I will stop sharing my screen to now allow Jennifer, Austin, and Rachel to present regarding GRIDD.
Thank you for the kind introduction, Professor Batt. Professor Batt is on the Scientific Advisory Board for the GRIDD project, so we're extremely pleased that, that he is giving the introduction to this project and this webinar today. So most of you, I can see that are members, and I can see that there are also dermatologists. So I think a lot of you are familiar with who we are as an organization, but I'll just quickly say that the International Alliance of Dermatology Patient Organizations, also known as GlobalSkin, is a global umbrella organization for dermatology patient organizations around the world. We have over 185 patient organizations in more than 60 countries, representing more than 50 disease areas in dermatology. So we are very focused as an organization on elevating the understanding and priority of dermatological diseases worldwide. And that's where the GRIDD project comes in. So I'm going to explain how that works. So the challenge that our patient organizations have, but I would also say that dermatologists have, is that decision makers, the ones that are who are deciding about new treatment options and whether payers will also pay for these treatments, they want the patient voice involved in those decisions. And they want patient stories, but they would much rather have the patient stories to fit into their decision-making rubrics in the form of data. And that's very difficult for patient organizations to be able to achieve on their own, because many of our patient organizations around the world are very small, don't necessarily have a lot of experience doing their own research. And it's expensive and time consuming to do that kind of work. So when we were founded as an organization in 2015, the highest priority activity that we were directed to take on by our founding members was to gather this quantitative data from a patient perspective that our patient organizations can use when they go and speak with decision makers and advocate for their patients. The vision of the GRIDD project, which is global research on the impact of dermatological diseases, is to have a quality of life measure that's developed by patients and to be able to present a credible patient voice built on verifiable data. And the vision is also that policymakers wouldn't ever make a decision without including a patient-led measure. So that's novel in dermatology, but that's also novel in other therapeutic areas. And so what we're doing is very groundbreaking. So here are all the firsts related to GRIDD. So it is the first global patient-initiated research in dermatology, across dermatology. It's the first research from the patient perspective on dermatological conditions across all these dermatological conditions. It's the first research on disease burden in multiple skin diseases. It is producing a unique and groundbreaking methodology to gather the impacts or the items from patients, which can actually be shared with other therapeutic areas if they want to do their own development of a patient-led measure. And it will also be unique in that we are developing PRIDD, Patient Impact of Dermatological Diseases, which will be a new measure in dermatology, and the first new measure across dermatological diseases in a very long time. GRIDD as a project will dispel myths where people don't understand that dermatological diseases are lifelong, high impact, people have difficulties that last their entire lives that impact their long-term life decisions. We will also quantify the impact in a way that's never been done before. So we're going to fill a data gap that is currently impacting the ability of patient organizations, dermatologists, researchers to be able to speak with authority about how diseases really impact these patients. The objectives are to conduct an extensive literature review, which is complete, develop the new global measurement tool, which is nearly complete, which we'll explain, gather the data using the new measure globally, and then have a robust database. So we'll go through all these phases with you. Rachel's going to give a lot more detail in a moment. This is our scientific advisory board. I'm sure when you look at this list, you'll see many people that you recognize, including Professor Batt, who is the representative of the ILDS. But you'll also see there Professor Andrew Finley, who is the author of the DLQI, which is the measure that's most commonly used in dermatology. So the fact that he's on the board really shows his support and acknowledgement that we need this new measure in dermatology. This is our project team. You'll see Rachel's name here. She's with Cardiff University, and she's working with Professor Chris Bundy as the co-lead researcher. And University of Hamburg, Professor Matthias Augustine is the co-lead, and these are his researchers. And then our team at GlobalSkin. So this is a pretty unique project in that we're all working together, the academic institutions are working with a patient organization, and the value that our organization brings beyond the project management and raising the funds is that we have access to the patients. And that can be a very big challenge, as I'm sure everyone knows in research, to reach the subjects. But we have a vast network through our patient organizations to be able to bring those patients in and contribute to this project by providing their real life experiences. These are the funding partners that we're working with that are making this possible. Very arm's length though, I'll say, and I'm sure our scientific advisory board would attest to that. And then this is an overview of the GRIDD timeline. So you can see, as I mentioned, the systematic literature review is complete. That was completed in 2018. We have done the phase 2, which is around gathering all of the items, and that was complete in 2020. Despite the fact that we were in a pandemic, we actually were able to continue progressing the project and did things virtually instead of in person, adding to previous research we'd done in person prior to the start of the pandemic. And we have just completed phase 3, which is the prioritization of the impacts. We're now in phase 4. We've just completed the cognitive testing, and we'll soon be going into psychometric testing. Next year, once phase 4 is complete, we'll then do translation, cultural adaptation, and we'll launch PRIDD. And phase 6 will be around analysis of the data and getting the data in the hands of the patient organizations in a way that they can use it with the training that they need. So that's a very high level overview. To get more deeply into these phases, I'm going to pass the microphone, so to speak, to Rachel.
Thanks, Jennifer. So, as you'll know, patient-reported outcome measures are also known as PROMs, and these include, as Jennifer said, the DLQI, so the measures that the patient fills out. And these are really important because they're used in clinical trials to measure the effectiveness of a treatment, and they're also used in the clinic to make treatment decisions. So the first phase of the GRIDD project was a systematic review of all of the published dermatology specific PROMs. So that is PROMs that can be used across dermatological conditions. So in other words, we collected and analysed all the relevant studies about the development and validation of a dermatology specific PROM. And we had two main aims when doing this. The first was to establish whether any of the existing PROMs could be used to measure impact. And the second was to evaluate the quality of these PROMs and to make evidence-based recommendations for the use. To do this, we followed the COSMIN guidance, which is considered to be the gold standard tool for developing and evaluating PROMs. COSMIN use a traffic light system to indicate whether a PROM is good enough to be recommended for use. So where a PROM is in category C, it can't be recommended for use. So you can see that in the red segment of the pie chart at the bottom right. In category B, they would be considered amber, so they might be recommended for use, but they need further validation. And category A would be green go light, as they can be recommended for immediate use. We conducted a very comprehensive review. In all, we screened almost 13,000 relevant articles, and from these we identified 36 unique existing dermatology specific PROMs, including the DLQI. And what we found was that none of these PROMs were capable of measuring the full impact of dermatological conditions. Our results also revealed that none of the PROMs identified were of good enough quality to be recommended for use. And as you can see at the bottom right of the screen, no PROMs fell into recommendation category A, meaning that none were of good enough quality to be recommended for use according to the robust scientific criteria. And this was largely because there was a lack of patient input during the development process. So what our systematic review ultimately showed was that the measures that are currently being used cannot measure the full impact of dermatological conditions on the patient's lives and may not be fit for purpose. From our results, we knew that GRIDD needed to be developed with patients at the centre of the process, and that it was unique and important because it filled the gap left by the existing measures. So a key part of the research process and the GRIDD project is getting our results out there. Our manuscript on the systematic review has been accepted for publication in Acta Dermatologica, which is one of the top dermatology journals. It's right at the very last stages, so we think that it might be published in the next month or so, so do look out for that. And we've also presented it at a range of esteemed international conferences such as the EADV. So now that we knew that there was a real need for PRIDD, we started to develop it. And the first step in the development of any PROM is to define what it is that you're actually trying to measure. Now, the impact of a dermatological condition on a patient's life is quite an abstract concept because we can't see or touch it. So we can't hold up a ruler next to impact or put impact on a scale to measure it. And because we can't see it, we have to do quite a lot of work to make sure that what we're measuring with PRIDD is actually the impact of dermatological conditions and that we're measuring it comprehensively. So in this way, developing measurements of unobservable constructs like impact is often more complex and takes more time than the development of an observable construct such as severity, so things like PASI. We do this by speaking to patients and we gain an in-depth understanding of how their condition impacts them. And we had a really rich and diverse set of data to work with because 68 people from 29 countries and representing 29 dermatological conditions spoke to us, which means we have a really solid foundation to build PRIDD on. We analysed that information to develop what is called a conceptual framework. And basically this is a visual representation of the impact of dermatological conditions. And it's used as the first step in PROM development. And I'll talk a little bit more about our conceptual framework in a moment. Before I do that, here's a high-level overview of the results of the interview study. And it is really high-level overview. We had lots and lots of really interesting data. We found that dermatological conditions impact individuals, organisations and society, and that these also contribute to the impact of conditions. And this explains why experiences might be different across regions or cultures. We also found that there are different forms of impact. So some are point in time, such as pain and itch, but some can be cumulative in that they affect the patient's life course. So for example, what career they follow and the decision to have children. And finally, we found that impact is a multifaceted construct in that it involves several factors. So impact varies between individuals, between conditions and across time, but physical, psychological, social, financial, and daily life and responsibility impacts were common across conditions. It was also clear that the participants felt that while the physical impacts of their condition were important, the psychological and social impacts were often as significant, if not more so, but these were often underappreciated by others. So here is the conceptual framework of impact that we developed based on these interviews. And essentially it shows that any instrument that aims to measure the impact of these conditions on patients' lives must include 5 domains of impact shared across conditions, shown in the middle of the screen. The conceptual framework is used to develop items for PRIDD, items meaning the questions or the statements in the measure. And on the right of the screen, I've given some examples for each of the items. So based on our findings, the social domain of PRIDD should ask people about their experiences with social isolation, romantic relationships, and other people's reactions. And I think this really shows that though dermatological conditions can be highly visible, their impacts are often not visible to others. So we've submitted a journal article on this phase of GRIDD to a leading journal on the development of PROMs, and we've presented at the international conferences on the right of the slide. So we used the conceptual framework and the results of the previous study to generate over 263 impact statements. These included things like, because of my skin condition, my sleep is disturbed, or because of my skin condition, I am anxious. So the next thing that we did was we conducted a global Delphi survey, and this is a method used to seek consensus from a group of experts on a particular topic. So we aimed through this to identify which of these 263 impacts patients thought were the most important to prioritise for inclusion in PRIDD. And we were also able to test whether the results of the previous study and the impacts identified were endorsed by a wider group of patients, and to check whether we'd missed any important impacts. The Delphi survey consisted of 2 rounds to reduce the initial list of impacts from a long list to a short list, and finally to produce the first draft of PRIDD. And to reflect the global target population of PRIDD, we translated the survey into a number of languages using standard forward and back translation methods. In all, 1,154 people living with a dermatological condition participated in this Delphi survey. Next slide, please. 61 countries were represented. And you can see which ones on the map and also the top countries on the left. So we had a really good basis and good representation to provide evidence that this measure is applicable and relevant to people across the world. And 90 diseases were represented in all. As you can see, relevant to their prevalence rates, some disease groups were overrepresented while others were underrepresented. We prevented this from exerting undue influence on the results and the impacts to be prioritised for inclusion in PRIDD by checking for significant statistical differences between these groups and the overall sample. So over the 2 Delphi rounds, we were able to move from a list of 263 impacts to produce the first draft of PRIDD, which at 27 items was feasible to use, which we would not have been able to do without patient input. It would have been a case of us trying to second guess what patients wanted and thought was important to include otherwise. So patients really have played a key part in getting this final product. So next slide, please. So here is a sample of the first draft of PRIDD. I think this is the first time that we've shared this. We've just shown the instructions and some of the items to give you a flavour. And here are some of the testimonials from people who participated in the Delphi survey, which speak to the relevance of the items and also the importance of the project, the GRIDD project as a whole. So just in the first quote, one participant said, "Taking the GRIDD survey was so rewarding. It caused me to do a lot of reflecting. Some reflecting was easy and some not so easy. The questions are extremely exact and edited so there's no fluff, just the facts, ma'am. It felt almost like someone had heard my most secret laments." And this was echoed through quite a lot of the testimonials and feedback that we had. So over the summer, we conducted a pilot test of that first draft of PRIDD with patients to assess whether it works as we intended it to and to make refinements. So we were checking whether there were any ambiguities in the wording, if there was any ways that we could make the items and the questionnaire more clear to people and make it easier to answer. So we conducted in-depth interviews with 12 patients representing 6 dermatological conditions in 4 countries. And each aspect of PRIDD was evaluated, so the instructions, the recall period, the questions and the response options. And this is really important because it's considered to be a key way that we have evidence that each of these aspects work well. So overall, the pilot test was really promising. Patients found PRIDD to be comprehensible, so they understood it. It was comprehensive in that it captured many of the most important impacts of their conditions, and it was relevant to them as well. So there weren't too many items in there to make it comprehensive that were also not relevant to people. And it was acceptable and feasible, so people were able and willing to complete PRIDD. One participant summed up the overall feelings of the interviews by saying that, "I've completed a lot of dermatological questionnaires, but I don't think I've ever seen them all integrated like this in such a questionnaire. I'm very, very happy with this. It has stirred my heart. There are things here that I want to discuss with my dermatologist. I'm really, really impressed with this. It's very good. It's excellent." And that summarises what we found when we looked at the systematic review. The measures that we found there is that some of them capture some aspects important to patients, but PRIDD appears to be the first one that captures them in a unified instrument. So we did make some edits based on patient feedback. So we changed the recall period so that we asked patients to think about how their condition had impacted them over the last month instead of over the last week, as this came out really strongly from patients that this would be the most appropriate time frame. The response options were reduced from 6 to 5. We did originally have a response option of not relevant, but all participants felt that the items were relevant to them. The instructions and the question ordering and wording were changed to improve clarity and increase the patient's confidence in their ability to respond to the questions. So in this stage, we fine-tuned PRIDD based on patient feedback so that it's in the best possible position for the next phase of research. Which brings me nicely to the next phase of research, which is the psychometric testing phase. And it's really important at this stage to step back and think about what makes PRIDD or any other PROM a measurement instrument rather than a simple survey or series of questions. And in measurement instruments, each of the items or questions can be scored and are summed to give a total score. And this implies that it's a statistical instrument, and with that comes some assumptions that need to be met for it to work properly. So in the previous phases, we were trying to make sure that what we were actually measuring was this abstract concept of impact. Now in this psychometric phase, we're testing whether the PRIDD works as a statistical tool. And there are 2 steps to do this. So in the first step, we'll ask patients to complete PRIDD, and we'll do some tests to make sure that it works well. So for example, we'll check whether each of those 5 domains of impact can be seen in the measure. We'll be checking if there are any problems with any of the items, and to check that the items that we thought were associated with each domain, so whether the item on pain is associated with that physical domain, whether they do, and if not, we can think about moving those items around. And based on what we find, we might make some final refinements to PRIDD. And then in the next stage, we'll ask patients to complete the final version of PRIDD, and we'll use that data to quality check PRIDD in the same way that we did for the PROMs that we evaluated in the systematic review in phase 1. We'll also use this data to understand what the scores PRIDD producers actually mean. So this means if you complete PRIDD and you get a score of 20, what does that mean? Does that mean a patient has little impact, or does it mean that they have severe impact? And what about someone who scores 25? Are they much more impacted than the person who scored 20? Or is the difference not meaningful in real life or clinical terms? So we'll answer these questions so that patients, dermatologists and researchers know what the scores on PRIDD mean. So once we have the final version of PRIDD, we can start to collect the global data on the impact of dermatological conditions, what initiated the whole development of PRIDD. While developing PRIDD, we followed the best practice and developed the measure in 1 language first. So the next step will be start to translate and validate PRIDD into different languages and cultures. And we'll also disseminate PRIDD and provide training on it and its use to a range of stakeholders, including dermatologists and researchers and patient organisations.
Thanks, Rachel. I'm going to take this next one.
Mm-hmm.
So I think Rachel's given a really thorough overview of all the work that she and the other researchers have been doing. I think it's amazing, the work that they've accomplished, particularly in view of the fact that we're in a pandemic and we haven't had a slowdown. That's really significant in our research. We've been able to accomplish a lot. Once all of that psychometric testing is complete and we've done the translation and the cultural adaptation, then we will be ready to begin collecting the data worldwide and doing the analysis. Once that data has been collected, again, our patient organizations will be so important and have been so important in all of these phases. We still have more work for them to do to help us get patients involved in the psychometric testing. But once we have the final PRIDD and we launch it, then we're going to want patients all around the world in large numbers to complete the survey. And then we will have that large data set. And then we'll be able to do analysis and derive all of the insights that we need, that we want to share with decision makers. And coupled with that, our organization will be focused heavily on doing the coordination around how we do the global communication and advocacy work while we empower and support with data and tools and resources our patient organizations to do it at their local and regional levels. So that will involve education and training for the patient organizations. And we'll obviously be working with our researchers to really be telling the world about this new measure and to increase the use of that measure in real world situations, including clinical studies and research, hopefully in clinical settings as well. And from the global perspective, we want to take this data and really impact the disability adjusted life years rankings of dermatological diseases, which we view as being seriously under prioritized and rated. And eventually we would like to take that data and work with the global dermatology community to seek a resolution, hopefully at the WHO level on all skin diseases. In terms of the next steps with with you dermatologists and you, our patient organizations. So we will be doing the psychometric testing. At this point, it looks like it'll start in very early November. And so we will be looking for select patient organizations to get their patients involved. So we'll be reaching out to those patient organizations. And if you're a dermatologist and you're interested in having patients participate, please reach out to us. We can provide you with ethics documents for your institutions. And then in also this fall, we will be taking the Delphi data, which is a really large, unique set of data that we want to use sort of now before we have the full data from the final PRIDD. So we'll be doing analysis and sharing that data early next year. We'll be doing the retest portion of the psychometric testing. So we'll be doing that first bit this fall, the second part in the early part of 2022, and then the translation and validation of the measure will take place also in 2022. So we'll really be calling on our patient organizations to get involved with the psychometric testing, and then eventually to get their patients responding to the final PRIDD questionnaire. This is just a quick summary of the benefits to the dermatology community. So this is a groundbreaking global project. I hope you'll agree. We're doing things that have never been done before in dermatology, but also perhaps in research in general across diseases. This new measure is really going to put the patient at the center with their voice to influence policy and payer decision making. We want to fill that need for patient impact data, which is why we're doing this. This is what our patient organizations told us when we were founded, and this is why this project is one of the top priorities for GlobalSkin. And we want to engage with the global dermatology community around a common goal. And we have already been having a lot of those multi-stakeholder conversations. We think that GRIDD is going to play heavily in the work that we'll do together as a broader community around elevating the understanding and prioritization of dermatological diseases for better care and treatment and affordable access for patients. And we will be developing new proof points for the public and policy decision makers. We'll be building that narrative with this data about what it really is like to live with a dermatological disease, and how this is a very impactful situation on patients' lives. So we're going to change the way that people see dermatology globally. So I just want to say thank you very much to Rachel for presenting. I think she did a great job. She's been an amazing driver in this project, and you know, Cardiff University and University of Hamburg have been amazing partners. And I also want to say thank you to all of you for attending today, but also more importantly for your support of this project going forward and for helping us to get patients involved. That, you know, we really can work together to change things for patients around the world by having verifiable data. So thank you very much.
Thank you so much, Rachel and Jennifer, for an amazing in-depth presentation on GRIDD and how it's really changing the way that we see dermatology. I would like to now share my screen so that we can have a very special guest join us today. I'd like to ask Bill to turn on his screen and unmute himself.
Here I am.
There you are. Hi. Nice to have you, Bill. All right, so I'll just dive into your introduction here. So Bill McHugh is a patient organization leader and patient advocate. In 2012, after a 40-year career in publishing, public relations, and marketing communications, Bill McHugh was diagnosed with pityriasis rubra pilaris. In the years that followed, he created the PRP Alliance, built a PRP global database, created the PRP Survival Guide, and became a founding member of the International Alliance of Dermatology Patient Organizations, GlobalSkin. During the past 8 years as administrator, the PRP Facebook support group has grown from less than 120 to over 2,600 members. Welcome, Bill. I'll be moderating a really wonderful interview with Bill today. So, Bill, I will ask you the first question here if you're ready.
I'm ready.
Fantastic. So please tell us about your own experience as a patient participating in the GRIDD Delphi.
Well, in August 2012, I was 66 years old. I had retired after 40 years in publishing and public relations. I was a husband, a father, a grandfather. My only medical issue was type 2 diabetes, which I had under control. I walked 4 miles a day, and life was very, very good. And then a red dot, the size of a dime, appeared right about here in my forehead. My life didn't immediately come to an abrupt halt. It took 3 months, 4 biopsies, 6 days in a hospital before I got a proper diagnosis of pityriasis rubra pilaris. That was when my life came to an abrupt halt. A skin disorder is one thing. A rare skin disorder like PRP is quite another. Patients with PRP are terminally frustrated. There's no FDA-approved treatment. As PRP patients, we have learned a simple truth. Retinoids, immunosuppressants, and biologicals help some of us, but not all of us. Our mantra, what works for one doesn't work for all. At best, it's trial and error. As patients, we feel isolated. Well, GRIDD Delphi was the first time in 8 years that I felt someone was actually listening to the PRP community. In fact, they were listening to me. Completing the GRIDD Delphi survey was not for the faint of heart. I remember seeing my code number at the very beginning, a 10-digit alphanumeric code ending 0005. Well, I told myself I was the 5th person to take the survey, and maybe I was, but I was excited. I was ready to bring it on. Well, the very first section of the physical impacts, it includes 33 statements. And until that moment, I had never seen a comprehensive list of the physical impacts of PRP. And they were within that group of 33. I checked 26 of the 33 as very much, and 3 as quite. GlobalSkin got it right. Someone actually did their homework. When I submitted my completed survey, I made a commitment to recruit as many of my fellow PRP patients as I could to participate. That was an opportunity I could not let them slip by.
Thank you so much, Phil, for your first answer. It's really wonderful to have you be involved with GRIDD from really the very beginning. So the second question here, what have you heard from patients that your organization supports about their impressions of GRIDD?
Well, nearly 200 patients participated in GRIDD. These folks saw, as I had, it was an opportunity to finally be heard. Each took the necessary steps to have their testimony recorded. And at times it was challenging. There was a general consensus among participants that the 268 or so statements were relevant and spot on. In fact, I didn't hear a single suggestion for a question that should have been added. That was interesting. No one complained about the number of questions or the time it took to complete the survey. That surprised me too. Some thought it was emotionally painful to focus on so many challenges, but they forged ahead anyway. And many wish they had copied their survey answers for future sharing with their own dermatologists and other healthcare professionals. A few thought the questions reminded them how bad their PRP journey had been. Some realized that the journey was more challenging than they had remembered. Others felt that looking back helped them realize how strong they were over that long haul. There was consensus that PRP patients need to take such a comprehensive survey periodically, perhaps every 6 months, to help them document their own personal journey. The psychological section was particularly painful to complete for more than a few participants, especially personal relationships. The 45 coping statements, that's in section 5, were especially well received. They were considered the to-do list. In particular, I cope by seeking out people with my condition. And that's why people get involved in the PRP Facebook support group. And then number 10, I cope by learning all I can about my condition. That struck a chord with everyone. There is a need within a rare disease community to learn more than is available.
Thank you, Bill, for a really eloquent answer and explaining how, despite how challenging emotionally it might be to answer the questions, the importance of doing so. And thank you again for recruiting so many PRP patients to participate. So I'll move on to question 3, our last question. Why is it important for dermatologists to get their patients participating in the GRIDD project?
I remember a slide in a GlobalSkin presentation before there was, in fact, the International Alliance of Dermatology Patient Organizations. This goes back to June of 2015. It was a daily chart provided by the World Health Organization. I learned that the daily asserts that the most appropriate measure of the effects of a chronic disease is time, both time lost due to premature death and time spent disabled by a disease. No one has ever died from PRP, but every one of us was disabled. The daily slide listed dozens of disease categories in a ranking where the disease categories at the top of the list were considered more burdensome, more worthy, and the categories at the bottom of the list were considered less burdensome, less worthy. Dermatological diseases were so far down the list that I thought there might be a special category for us called worthless. That's how we feel. Dermatological diseases are simply underrated. We owe it to these patients to set the record straight. It's a prerequisite for making our lives better. Improving the quality of life of every dermatological patient should be our goal. Patient leaders and organizations can push our communities towards GRIDD. And similarly, dermatologists can push their patients towards GRIDD for the greater good. Together we can improve the position of dermatological diseases on the daily ranking.
Thank you, Bill, for reminding us of the importance of collaboration between dermatology patient leaders and dermatologists in the medical community themselves, as well as researchers. It's all a collective effort to improve the lives of dermatology patients. Thank you again, Bill, for your amazing presentation, and it's been a pleasure to work with you with GRIDD, as I believe the researchers and GlobalSkin agree. So, Simon, off to you.
Well, thank you to all our presenters today. We've learned a lot about the importance of GRIDD and the importance of collaboration between dermatologists, patient leaders and patient organizations. We are now opening the floor to anyone who would like to ask our presenters questions. Please feel free to unmute yourself and turn on your video, or you can type your questions in the chat and Nicole or I will read it aloud.
I represent India, the region of the Southeast Asia. And we have a big population also, and we have lots of dermatology patients, and we have nearly 12,000 dermatologists in India, actually. So can we somehow participate in your at least phase 4, this one, involvement in your project, PRIDD project?
Definitely, we'd love you to. Is the answer to that?
I will mail you. Yeah.
Yeah. So Jennifer, you might be, or Nicole, best placed to answer how exactly. But we would really love to hear from patients in India.
In terms of getting patients involved in India, we do have some patient organizations that are quite active in India, but I think that if there are dermatologists that want to send their patients to complete the questionnaire, there will be a link that we will provide to the ILDS that they can share with the patient societies and board members. So we're not looking for a huge sample. We're looking for probably about 500 patients to participate worldwide. And we want to have good diversity of disease and region. So in some ways, we want to put it out to the world, but in other ways, we don't really need to yet. We want to save that for when we have the final PRIDD. So, but I think that regions like, you know, or countries like India can tend to be a bit underrepresented. So I think it would be helpful if dermatologists were to encourage their patients to participate. And it shouldn't take long. As you saw, we've gotten the questionnaire to be quite short and succinct through the process that the researchers have taken us through. So it's 23 questions now. So it's not a huge burden to ask patients to complete it. I see that Isabel's also asked a question. Maybe I'll just read it. So she's asking if we can get some of the statistics that Rachel quoted, like the graphs on response levels from the various skin diseases. So yes, we do plan to share some of this data with our patient organizations, Isabel. We're just, Rachel is going to be doing the analysis, but Rachel has also just been in the process of submitting her PhD, her thesis. So she's been pretty busy, but she will be turning her attention to doing some of this analysis. We'll be presenting some of the data to our European patient organizations this fall at a patient organization event that we're doing, but we'll also be sharing the data other ways with our patient organizations, so you can be sure to see that.
Thank you, Jennifer. I'm not sure if there are any other questions for our presenters, but if not, maybe before folks, oh, Jennifer, go ahead.
Just one last one. I see that we also got just one other question about when do we want to start winding people up to get involved? So we will be in touch with patient organizations in October. We might not reach out to all patient organizations because, again, our sample size is only 500. So we'll be strategically deciding which patient organizations to reach out to. If you're really interested and you want to be involved, feel free to reach out to Nicole and let her know. Nicole maybe can put her email address into the chat, and we can start getting our patients excited in those countries and diseases that we choose in October with the plan to launch in early November. And I also see Steve asked a question about the method to reduce the number of questions. What was the criteria for inclusion? So Rachel, I don't know if you have a succinct, quick answer to that.
Yeah, so we used a priori consensus criteria. So we determined what the consensus criteria were up front. So that way there was no chance that we could be data mining or cherry picking any items that we thought should go in. It was really driven by patients and how many of those felt that the measure should be included. So really briefly, we followed the guidance set based on a systematic review of Delphi consensus criteria. And it was based on percentage of people who deemed the individual impact item to be critical or not critical. So we could prioritize impacts, and we could also delete impacts if lots of participants were saying, you know, this really isn't important to me. That will be included in the paper that we publish, so you can have a look exactly at what the thresholds were, but that's a general overview.
Awesome. Thank you, Rachel, and thank you, Dr. Amash, for your question.
Thank you all, and as a reminder, we have recorded today's session and we'll be sure to share the link in about a week.